In 2021, the COVID-19 pandemic worsened in the East Asia and Pacific region, reinforcing the critical role of water, sanitation, and hygiene to limit the spread of diseases. UNICEF worked with governments and other partners to ensure that water and sanitation services continued to function, ensure access to soap and menstrual hygiene supplies, and strengthen hygiene measures in healthcare facilities, schools, and other public places. Let's look back on our key achievements for children and their families in 2021. Across 18 countries, we supported over 167,000 people to access basic water services, more than 550,000 to access basic sanitation services, and nearly 1.2 million people to access basic hygiene services in their homes. Using risk assessments, we adapted water, sanitation, and hygiene services to ensure they are resilient to climate hazards like floods and droughts. At the regional level, we developed the systemic approach to climate-resilient wash and a catalog to identify low-carbon and adapted technology options. We partnered with governments and civil society to strengthen the enabling environment for the effective delivery of wash services, supporting new policies in Vietnam and Fiji, and strengthening monitoring across the region. We assisted over 2,300 communities to become open defecation-free, improving the health and dignity of over 1.4 million people. After more than 10 years of support, many governments have incorporated the community-led total sanitation approach into their sanitation programming, such as Cambodia, the Philippines, and the Lao People's Democratic Republic, drastically reducing open defecation. But our work can't stop with the elimination of open defecation. To ensure basic and safely managed sanitation, we worked with governments, service providers, civil society, and the private sector, strengthening monitoring, developing markets, mobilizing funding, and supporting smart subsidy design for the poorest households. We helped equip over 7,400 schools with child-friendly and disability-inclusive wash facilities in partnership with governments and communities. We trained teachers and government staff on hygiene and infection prevention to support school reopening. We provided wash services to over 300 healthcare facilities, strengthening infection prevention and control, and laying the groundwork for the pandemic recovery. To support access to menstrual health and hygiene information, we partnered to expand Oki, an educational period tracker app, co-developed with adolescent girls in Indonesia, Mongolia, Papua New Guinea, and the Philippines. And we remained on the front lines in emergencies, reaching 480,000 people with basic drinking water supplies and 195,000 people with sanitation facilities. We supported children and their families affected by floods, cyclones, and typhoons in Fiji, the Philippines, Solomon Islands, Timor-Leste, Vanuatu, and Vietnam. In Myanmar, UNICEF provided essential wash services and supplies to people affected and displaced by conflict and natural disasters. But despite this progress, there is much more to do to fulfill the promise of Sustainable Development Goal 6, safe water and sanitation for all. Recovering from the pandemic is an opportunity to reimagine a more inclusive and green future for every child in the East Asia and Pacific region. We will continue our work with governments, civil society, and the business sector to ensure all wash systems are climate resilient and work towards a low-carbon world. We will help families access safely managed services, ensuring drinking water quality and safe management of human waste, from toilet to treatment and safe reuse. We will scale up climate-resilient wash in schools and healthcare facilities while ensuring the inclusion of the most marginalized children. We will work with young people to bring their voices to policymakers and to help their creativity and innovation shape the future they want. We would like to thank our partners in the East Asia and Pacific region. Together, we can fulfill the human rights to water and sanitation. To learn more about our work, please visit our website and read our annual results report.